I'm Dr. Abhishek Mangeshkar, an endometriosis specialist and excision surgeon. And today we're discussing polycystic ovary syndrome, or PCOS. PCOS is one of the most common hormonal disorders affecting women. It is often misunderstood, misdiagnosed, or even dismissed. It can impact everything from menstrual cycles to fertility, metabolism, and long-term health. As an endometriosis specialist, I frequently see overlap and confusion regarding endometriosis and PCOS, as both conditions can affect menstrual health and fertility. In this video, we'll explore what causes PCOS, how to recognize the symptoms, and what treatment options are available, how PCOS differs from endometriosis, and why getting the right diagnosis matters. Let's break it down. PCOS is a hormonal disorder that affects the ovaries that lead to irregular menstrual cycles, excess androgen levels, which are the male hormones, and multiple small follicles in the ovaries. Despite the name, you don't actually need to have cysts on your ovaries to have PCOS. It is estimated that 1 in 10 women worldwide have PCOS, making it one of the most common reproductive health conditions. Yet many women go undiagnosed for years because the symptoms can vary widely from person to person. The exact cause of PCOS is not fully understood, but is often believed to be influenced by several key factors. PCOS is often associated with high levels of androgens, which are the male hormones like testosterone, which can disrupt ovulation and cause symptoms like acne, oily skin, and hair growth. PCOS often runs in families, suggesting a genetic component. If your mother or sister has PCOS, your chances of having it are higher. Many women with PCOS have insulin resistance, meaning their bodies struggle to use insulin effectively. This leads to higher blood sugar levels, which can cause weight gain and an increased risk of type 2 diabetes. Chronic low-grade inflammation has been linked to PCOS and may contribute to the increased androgen levels. These underlying factors don't affect everyone in the same way, which is why PCOS can look very different from person to person. PCOS symptoms vary. The most common signs include irregular or absent periods. Some women have very few periods per year, while others may experience prolonged or heavy bleeding. Excessive hair growth, known as hirsutism. High androgen levels can cause coarse hair growth on the face, chest, back, or abdomen. Acne or oily skin. Androgens can also lead to persistent acne, especially along the jawline and lower face. Hair thinning or hair loss. Some women experience male pattern baldness or thinning hair due to the increased androgens. Weight gain and difficulty losing weight. Many women with PCOS struggle with weight gain, particularly around the abdomen. Fertility issues. PCOS is one of the leading causes of ovulatory infertility. Irregular ovulation makes conception difficult. Fatigue and blood sugar issues. Insulin resistance can lead to energy crashes, sugar cravings, and a higher risk of developing type 2 diabetes. Dark patches on the skin, which is a condition called acanthosis nigricans, can cause dark, velvety skin patches in areas like the neck, armpits, and groin. If you experience several of these symptoms, it's important to talk to a doctor for an evaluation. Diagnosing PCOS can be challenging because there is no single test that confirms the diagnosis. Instead, doctors rely on a combination of medical history and symptoms, which is understanding menstrual patterns, hair growth, acne, and weight changes. A physical examination, which is checking for signs of excess androgens, such as facial hair, acne, or scalp hair thinning. Blood tests, which help us measure hormone levels, including testosterone, LH, FSH, and insulin. An ultrasound, which is a pelvic scan, to help check for multiple small follicles on the ovaries, often called polycystic ovaries. A diagnosis is usually made using the Rotterdam criteria, which require at least 2 of the following 3. Irregular or absent ovulation, signs of high androgens, which are based on blood tests or physical signs like hair growth, polycystic ovaries on ultrasound. Treatment options for PCOS. While there is no cure for PCOS, the condition can be managed effectively with lifestyle changes, medications, and sometimes surgery. Exercise, which is regular movement, can improve insulin sensitivity and help regulate periods. A low glycemic diet rich in whole foods, fiber, and healthy fats can support blood sugar balance. Even a 5 to 10% weight loss reduction can improve symptoms and ovulation. Birth control pills help regulate periods and lower androgen levels. Metformin can be used to improve insulin sensitivity, especially in women with insulin resistance. Anti-androgen medications such as spironolactone to reduce excess hair growth and acne. Ovulation induction medications such as letrozole or Clomid for women who are trying to conceive. In some cases, ovarian drilling, which is done by a laparoscopic approach, may be done to restore ovulation, but this is not commonly used anymore. As an endometriosis specialist, I often see confusion between PCOS and endometriosis. While they are separate conditions, they can coexist in some women. PCOS is a hormonal disorder that affects ovulation and androgen levels. Endometriosis is a disease where tissue similar to the lining of the uterus grows outside the uterus, causing pain and inflammation. Some women with PCOS also have endometriosis, and because both can cause irregular periods and infertility, proper diagnosis is crucial. If you have PCOS and experience severe pelvic pain, painful periods, or pain with intercourse, it's worth discussing with your doctor whether endometriosis might also be a factor. PCOS is a lifelong condition, but with the right management, many women can control symptoms, regulate their cycles, and improve their overall health. If you have irregular periods, weight changes, or any of the symptoms we discussed, talk to a doctor about getting evaluated. The earlier PCOS is diagnosed, the better it can be managed. Thank you for watching. I hope this video has helped clarify what PCOS is, how it's diagnosed, and the best ways to manage it. If you have PCOS or are struggling to get a proper diagnosis, feel free to share your experience in the comments. If you found this helpful, don't forget to like, share, and subscribe for more content on managing women's health conditions. Take care, and I'll see you in the next video.